Dr. Pie Cabrera. Whatever need you have, nakikita ko with Exosomes, kaya niyang i-address open pores, fine lines, improve the texture. What's nice about Exosomes is, hindi naman siya new, pero last year ko siya na-discover in one of the conventions. And when I tried it to myself, nakita ko talaga improvement. It makes your skin glow, it hydrates, and yung mga fine lines nakakatulong din. Patients are usually asking, which is better, the exosomes, stem cells, or PRP? It depends on the need ng patient. But whatever need you have, nakikita ko with exosomes, kaya niyang i-address, for example, your open pores, fine lines, improve the texture, and even the deep scars, yung deep acne scars na malalim. From acne, talagang bumababaw as in. Very satisfied patients, especially for deep acne scars. With PRP kasi and with stem cells, we still have to get yung serum from the blood ng patient, dadala pa sa laboratory. It's medyo time-consuming din. Unlike with the exosomes, especially the one I'm using with 20 billion exosomes, maganda yung effect na it really stimulates the collagen of the patient. For the method of delivery ng exosomes, it really depends on the skin. Like for her, she's only in her 30s, maganda naman yung skin niya. You just want to minimize some of the pores and make her skin glow more para lalo mas fresh yung itsura niya. What I'll do is inject the exosomes on her skin. Sa ibang patients, we can do laser and put exosomes. Sa iba naman, we can do microneedling. We can also do the mesogun technique. And can use it on the hair, on the neck, chest, hands, pwede. Even for stretch marks, maganda.